Hello, everyone. Thanks for joining us today. I'm Jana, and I will actually be the moderator with Dr. Vidor today. Dr. Vidor got pulled away for one quick moment, so he'll be joining us here any moment. In the meantime, I wanted to go over some just general things to know about the webinar today. There is a questions box in the GoToWebinar panel. So as we go through today's webinar, if you have any questions, feel free to go ahead and just ask those of Dr. Vidor. At the end, he'll also go through some frequently asked questions, and if your questions are answered during that part of the webinar, I will go ahead and read him your questions, and he'll answer them live today. With that being said, I'm going to give him one more moment to join here, and if not, then I'll get started, and he'll join us for the Q&A. So I'm just going to give him 1 minute here. And again, thank you all for joining today. Okay, sounds like
All right,
he's
I'm here. Sorry about the wait.
Sorry, Dr. Vidor. I just had introduced you or went through the housekeeping and just letting know you're with a patient and we're just wrapping up. So without further ado,
thanks everybody for waiting. Sorry about the delay.
Without further ado, I'd like to introduce Dr. Vidor. I'm going to go ahead and share my screen now. Okay, so all right, over to you, Dr. Vidor.
So thanks everybody for coming and for logging on to this. Hopefully it's helpful and informative. And if there's any questions, feel free to ask at the end here. So my name is Vidor. I'm an oculoplastic surgeon. And this webinar is hopefully going to give you a little bit more information about droopy eyelids and things we can do to correct them and see if it's something that would be appropriate for you. This is an obvious slide. Why are droopy eyelids bad? Well, they can make you look old, but they can also do things that affect your quality of life, like impeding your vision, making daily tasks, driving, reading, working on the computer difficult, depending on how heavy or droopy they are. Are you doing the slides or am I doing the slides? Okay, thank you. So what are the most common causes of droopy eyelids? So eyelid skin is very delicate and it can stretch very easily. So as you get older, the tissues in the eyelids tend to relax a bit and the excess skin can start drooping and sometimes even impeding your vision. So the most common reason is age-related changes. Occasionally we see things like trauma that cause issues with nerve or muscle function, other medical issues which are much more unusual, neuromuscular problems, and just genetics. If your parents have droopy lids, it's more likely you're going to have droopy lids. So what can we do for this? So blepharoplasty is a lid lift or eyelid surgery. It is one of the most commonly performed surgical procedures in the United States, cosmetic and functional. And we can go over that in just a second. You want to go to the next slide? So blepharoplasty is probably the most common procedure I perform, blepharoplasty and ptosis repair. The whole process typically takes an hour or two, sometimes 3, but the actual procedure takes about 30 to 45 minutes. We make a little cut in the crease of the upper lid, take off some of the extra skin and fat if there's extra fat. Occasionally we can remove a little muscle. Most of the time I leave it because that muscle is typically good for you. And then we close the incision with a row of sutures. Now we can do this surgery in the office with some local anesthetic, or we can do it as an outpatient with some twilight anesthesia in the surgery center. It kind of depends on the patient preference and also a lot on a patient's health, whether they're stable to do something in the office or in the operating room. So what do you do to prepare for it? So we get clearance from primary doctors. So basically you would see your primary or at least contact them to say, yeah, you're okay to have a procedure. Smoking is always bad for surgery. You want to stop it as long as you can before. 2 weeks is enough. I actually like people to stop for as long as possible afterwards so the smoke doesn't get in the way of the incisions. Patients who take blood thinning medications, they're all different depending on which medication you're on. We would have you stop that before the surgery. Generally, it's somewhere between a couple of days and a couple of weeks. And then other medications that interfere would be like supplements. There's certain herbs we would tell you to stop, a few other medications, and we could always list those for you when we see you. If you're going to have surgery in the operating room, we have you stop eating at midnight the night before. The other thing I'll add to the slide is I usually have patients stop no alcohol for about 24 to 48 hours before as well. So the recovery is usually pretty easy from an upper lip blepharoplasty. And I mean, I shouldn't say easy because there's no surgery that's easy, but most patients find that it's not that bad. So, you know, you go home, you take it easy, you ice a lot, you apply some antibiotic ointment to the eyelids and to the eyes, no exercise, no going in the pool for a week or two, and then you don't want to rub it. You want to make sure you just kind of take it easy and don't do anything that is going to mess up what's typically a very good procedure. Eye makeup and contact lenses are generally about 2 weeks. There are occasionally exceptions to that, but that's the standard. So just like any other surgery, for your result to be ideal, you want to make sure you follow your instructions and be patient. You know, recovery is generally about 2 weeks. Now, there are some patients who heal very quickly, and within a week they look perfect, and we take their sutures out and they're great. There are sometimes other patients that take a little longer than 2 weeks. Everything's kind of on a bell curve here. So if you fall in the middle of a bell curve, you'll be about a week or two. If you fall on either side, maybe you get lucky or a little less lucky and you take longer. But generally, everybody heals really well. So everybody knows, you know, when you do surgery, incisional healing, like if you look under the microscope, that takes months. So, you know, although you'll look really good in like a week or two, you know, the incision might still be a little red or a little thick. That's generally very easy to cover up or very hard to see, but that full healing can take months later. So there is another type of droopy lid called ptosis. And ptosis is a little different than something you would do a blepharoplasty for, which is called dermatochalasis, because what's actually going on with that is it's not just extra skin and heavy tissue. The muscle of the upper eyelid is either weakened or stretched out. So you can see in this picture here, ptosis on the image on the right, you can see how where the lashes are kind of blocking the pupil. Now that's different than if you had the image on the left, but there was just extra skin covering up where the pupil is. So it's actually a different problem, and it's very common. I'll go to the next slide. So ptosis is, many times it occurs with extra skin, and we do it both at the same time, but ptosis repair is a little different than doing a blepharoplasty. And there's a couple ways to approach it, depending on, you know, how droopy your lid is, how symmetrical they are, and how much function the muscle has. So we can either make the incision through the same place that we do for a blepharoplasty, or we can make an incision on the inside of the eyelid. We tighten the muscle up to get that eyelid lifted, and then we can take extra skin off at the same time if we need to. And depending on which incision we make, we close it either through the inside or through the outside. So there's a couple, you know, some frequent last questions. I'll answer some of the most common ones here. So one thing patients always ask, does it hurt, right? So not really. I mean, we numb your eyelids up. So after the numbing process, there is no more pain. And if you do the surgery in the operating room, you don't even feel that part. Most patients, when we do the surgery in the office, we also give you some numbing cream. We sometimes can give you a Valium to take to relax. It's usually not that bad. After surgery, most patients are pretty surprised at how little it hurts. Now, that's not 100% of the time, but most of the time it's a pretty easy recovery. Tylenol is usually enough for pain. Sometimes if I do ptosis, I'll give you a little narcotic just in case you need it. Probably 50 to 75% of patients maybe take one. So it's really not that bad. Just make sure you ice and take it easy. Another common question is, does insurance cover eyelid surgery? And just like the slide says here, the answer is maybe. It depends if your upper lids are heavy enough to where they're actually blocking your vision, and it can be clearly demonstrated to the insurance company that it is. So there's kind of a wide range of what's blocking your vision and what's not blocking your vision, but bothering you. And in the office, when I see you, we can always measure your eyelids and take a look and then do certain types of tests to confirm whether or not it would be covered. Unfortunately, cosmetic eyelid surgery, if you just don't like the way it looks, or if it's just a little bit of problem, but not enough to where insurance is going to cover it, that's never covered. But we do have financing, and there are a lot of different ways we can go about setting somebody up for cosmetic surgery as well. The other common question is, will my eyes still look natural? People are always worried that they're going to look different or they're going to look overdone. So that's not what I do. I make sure, my goal is to make patients look like themselves, but refreshed. I don't want someone to look different, and I don't want someone to look like they're surprised. That is extremely rare. Now it's surgery, so all surgery has its inherent risks, but it's not designed to be a procedure to make you look drastically different, just you but refreshed. The incisions are placed in the upper lid crease, so that hides them. And then if you have a muscle repair, it's either that same incision or from the inside. So typically, it doesn't make you look different, just like yourself, but refreshed. And then the other question is, can anyone have it? So most people can. If you're a surgical candidate, then you can. There are some medical problems that will preclude, almost anyone from having surgery, so we don't do that. And there are occasionally some eye problems that would make it so it's too high of a risk to have the surgery because it could damage the health of your eye. These are very rare things, but occasionally we see it. And again, smoking, you really don't want to be smoking when you do this, because you don't want to do a surgery and the surgery turns out great, but because the smoking's so irritating to the eyes and to the incisions, then it has scarring. So most people, the answer is yes. So what are some of the risks? Well, the risks are the same as most other surgery: pain, bleeding, infection, scarring. That's a risk of any surgical procedure. Infection is extremely rare with this, extremely rare. Bleeding, excessive bleeding is also extremely rare. Pain, again, we talked about that. Most people don't have much pain. Scarring can occasionally happen, also rare, and we can usually take care of any scarring that occurs in most patients. One thing that occasionally you can see is a little bit of asymmetry. That's most common when patients are very asymmetrical to begin with. We can usually correct that, but there's always a small chance that there would be an issue. Dry eye is something that we always look for. I always look for that during your consultation to see if your eyes are dry. People with really dry eye maybe don't want to have a ptosis repair or a muscle repair. It is a risk of surgery to have dry eye afterwards, but it's also pretty uncommon. Occasionally patients need other surgery. That's not common either. And an exceedingly rare risk would be damage to the eye. I have never seen that. I don't personally know anyone that's happened to, but it's just like any other procedure. There's always really crazy complications that we have that we discuss that don't really happen. Okay. Next slide.
All right. Are you able to see the slide? So the biggest thing is a cosmetic consultation for you. Are you able to see the slide, Dr. Vidor?
Yeah.
Okay, perfect.
Okay. So how to schedule a cosmetic consultation. So when we see you, we'll evaluate you. We'll look at your medical history. I always take into account your whole medical history. I know it's just on your eyelids, but it's still surgery. So we still have to take a look at you. I take a look, I measure your eyelids. I take a look at what your goals are and what you are looking to have your visual needs, what your lifestyle is, and what you're trying to get accomplished through this surgery, whether this is the correct procedure for you. And really the big thing is, I work with patients. I'm not trying to like force what I want on you. I tell you what your options are, and then we talk together about what the best plan is for you, and we work together to achieve that. All right, any other?
I'm going to go ahead and open up the floor. It looks like a few came in throughout.
Okay.
So if anybody has any questions, they can go ahead and chat those in the chat window or in the questions box. And to get started, I had retina surgery and have vision in one eye. Will this impede the surgery?
Will impede the retina surgery. Is that I guess that's the question.
They've had retina surgery, and have vision in one eye. Yeah. So would you do a vision in one eye, pretty much?
So that would be something I'd probably need to see in person to make that determination. If it's the good eye that you still have vision in and you want it lifted because you're having problems with it, I've done that quite a few times to help improve vision. And a lot of times we'll do the other eye that's not seeing as well also just to make it look nice. If there's no vision in the eye that's had retina surgery, sometimes that's hard to prove to the insurance that it will improve your vision by lifting your lid, but sometimes we can. It just kind of depends how much vision is lost from the retina surgery. In most cases, patients can still see somewhat, just may not be as good. and it's not an issue. So the answer is most likely we can. I just have to take a look at that individual case to make sure yes or no. So for that, we should schedule a consultation and take a look at it.
Perfect. The next question is there general or local anesthesia? I have central sleep apnea.
Okay, so sleep apnea is very common. We see it a lot. So we don't ever do a true general anesthetic for this, which is a general anesthetic is when you go to the hospital or go to the surgery center, we put you completely to sleep, put a tube down your throat, the machine is breathing for you. That's called general anesthesia. If you're gonna have this surgery, we either do what's like a local, straight local, kind of like you're at the dentist and we numb you up like that. Or we can do what's called a twilight anesthesia. That's what the other surgeries are done, not general. So twilight anesthesia, what we do is the anesthesiologist or an anesthetist will put an IV in you and they'll give you some medicine to make you sleepy, but you won't fall totally asleep. The only part you fall asleep for is when we numb it up so you don't feel that or remember it. Then we can either wake you up so you're pretty wide awake but very comfortable, or we can keep you sleepy. Patients with sleep apnea, sometimes we have to wake you up a little bit to do that, but it's generally not anything that's a problem because you're already numb. They've given you medicine to make you nice and sleepy. So sleep apnea occasionally can be an issue because you'll move around or obstruct, but we do patients that have sleep apnea all the time. We see it all the time. In fact, we find out and almost diagnose sleep apnea sometimes during the surgery because we can see that people are obstructing. So again, every patient's different. I want to make sure I see you and talk to you and see how bad your sleep apnea is, but typically that's not an issue.
Okay, a few more questions here. Can you correct a descended lacrimal gland?
So that's called a prolapsed lacrimal gland, and typically the answer is yes. It's a different procedure than a blepharoplasty. What we usually do, I'd have to take a look at you, is I do a standard blepharoplasty incision. I can take off a little skin if needed, and then we get to that lacrimal gland, and I'll usually kind of secure it back to the bone where it is. So that's something, again, I know I keep saying this, but I need to see you in person, but typically, yes, I can.
Great. Do I need clearance and or referral from my primary doctor?
So the first question, do you need clearance? Yes, if you're going to go to the surgery center and have anesthesia, you need a medical clearance. That is the standard of care is to have medical clearance before anesthesia. If you're going to have the procedure in the office, we'll usually just send like a letter out to your primary doctor, and they usually just say, okay, no problem. And the second part of the question was, I'm sorry, what was the second part?
Do you need a referral?
A referral. If you are a part of an HMO group, then you would need a referral. If you have PPO insurance or Medicare, then you do not need a referral.
Great. Is this an area that would be prone to a keloid?
So any area of the body can keloid. Typically, the upper lids don't tend to keloid as badly as the rest of the body. I still watch out for it, and there are things I can do and we can do as far as medication that would decrease the chance of a keloid forming. I'd have to kind of look at what the keloid is or the other keloids on the rest of your body to determine, but typically lids don't scar as badly as other areas that'll keloid. It's a much thinner skin, and it tends to heal better.
Okay, and then I've had left eye ptosis since birth. Is that common?
It is common, yeah. So ptosis since birth. So people who are born with ptosis they're kind of in a different category than most people who get it as you get older, where things kind of stretch out. When you're born with ptosis, the muscle itself never properly develops in most cases. So when I measure you in the office, I'll actually usually notice that the muscle function is not as good as normal. So to correct what we call, it's called congenital ptosis when you're born with that. To correct congenital ptosis, sometimes the procedure is different than typical age-related ptosis. So the answer is yes. That's a long-winded answer. Yes, it's relatively common, and I do correct that, but it sometimes has to be a different procedure than the ones I described, depending on how much the muscle works. So I'd have to look at that, measure your muscle, and tell you whether you can do a standard ptosis repair. We have to do something else to get the lid up because the muscle isn't working as well.
Would you ever recommend Botox first?
Maybe. I'd have to see you. Botox can give a little bit of a lift to the muscles that pull the eyebrows down and the eyelids down. And if you just have a little subtle bit of extra skin, sometimes that will work. Typically though, by the time you have enough extra skin that it's drooping over and covering your eyes, Botox is not going to be effective for that. But again, I'd have to see it to kind of see whether we could do a lift. Most patients I see, it's not going to be enough, but occasionally it'll work.
Okay. So the other question, or the last question, is, would insurance cover my initial appointment?
Typically, yes. If you're coming in where there's actual thought of a medical problem, or you think your eyelids are blocking your vision, usually insurance will cover the consultation. Now, if you're coming in for a pure cosmetic consultation, I don't like the way it looks, they won't cover that. So that's something that would be a cosmetic consultation. So if you think it's blocking your vision or you think it's causing you a functional problem, yeah, they'll cover the visit. And if you come in and it's clearly not blocking it, and I'll tell you, look, this isn't, but they should at least cover the consultation if you're coming under your medical insurance.
Perfect. And just for everyone here today, oh, there might have been one more question just popped up. Let me just check it out here. So where are you located? So, Dr. Vidor, if you want to take that.
Yeah, so for my Inland Empire office, our office is in Colton. It's at 1900 East Washington. I do have another office in Newport Beach that's not related to this office, so that would be a different entity. So for this purposes, this is for this office.
Perfect. And so for webinar attendees, there is that free initial consultation. So if you've never been in before to see Dr. Vidor, that is complimentary. If you're coming back for a second opinion or anything like that, that is usually billed to your insurance. We made a special page on the website for you, which is inlandeye.com/eyelid, to be able to book your consultation. So feel free to visit that page on the website to book. There's quite a few slots available for our webinar attendees. And then also, her line might be a little bit busy after this, but you're more than welcome to give us a call. You can talk to Stephanie, our care coordinator, which she can be reached at 909-254-0221 if you have any other questions. But we hope to see you. And it looks like maybe one more. Oh, and then someone else asked, do you have to wait after trying Botox?
Maybe it's hard to say without seeing somebody. It depends. That's something I really have to see them for. Ideally you do, just so if you tried it and you don't like it and you don't think it's working, maybe give it a couple months, let it wear off. But if you're a consistent Botox user, you always get your injections. No, that's fine. I can just see it. I can tell if there's extra skin. That's not going to get corrected with Botox. But some people, if they get too much Botox on their forehead, it'll drop their brow. And in those cases, I'll usually wait.
And that's something to point out too, that Dr. Vidor offers Botox, so he is well versed in knowing when to use that versus potentially the full procedure as well. So
yeah.
If there's any other questions, I'll leave the floor open for one more minute here. If not, we'll wrap it up today. See if there's any additional questions. It doesn't look like it. Okay, well, just so you all know, we'll go ahead and reach out to anybody who attended today. We'll send you a copy of the webinar for future reference. Feel free to give us a call or head to inlandeye.com/eyelid to book your free consultation. We hope to see you, and thanks again for joining today. Thank you, Dr. Vidor.
Thank you.